name is Christina Llanez. I am one of the consultants for the Nursing Consulting Partners Organization. And today my webinar is around PTAP accreditation, understanding the benefits of PTAP, what it is, and how NCP can support you on that journey. So it's titled Excellence by Design, Unlocking the Value of ANCC PTAP Accreditation. So what is PTAP accreditation really? So PTAP stands for Practice Transition Accreditation Program. It's administered by the American Nurses Credentialing Center and recognizes excellence in transition of practice programs. It applies to nurse residency programs as well as fellowship programs for experienced nurses transitioning to a different department, or new to practice nurse leaders, clinical specialists. Really, as long as you meet the criteria, it does align to those type of fellowship programs as well. What is the purpose of PTAP? And so it really promotes safe and effective transition into practice. These nurses that go through this program, it's structured, it's consistent, it's standardized. So you really give those nurses an optimal transition to practice experience. It also supports competency attainment, really setting those nurses up for success, improves their professional confidence, and enhances retention and engagement among the participants. Why PTAP matters? It demonstrates commitment to nursing excellence. It is, as many of us know, the same accrediting body as Magnet. So PTAP really is fostering nursing excellence in transition of practice programs. It provides external validation of program quality, and it aligns education with evidence-based standards, and also supports organizational strategic goals. So benefits of ANCC PTAP accreditation and why you should consider this accreditation for your organization, your nurse residency programs or fellowship programs. It really enhances the reputation of the organization and it really makes your program stand out. It provides you national recognition for excellence. It differentiates you among different residency and fellowship programs within the healthcare market. You also have recruitment advantages. Those nurses really want to be part of an evidence-based program that is accredited. And you really retain and attract that high quality talent, as well as you demonstrate commitment to professional development and growth. New to graduates, experienced nurses, really, this appeals to them. They really want to look for a residency program that's going to position them in the right direction, especially one that is accredited and evidence-based. And it does improve retention. It provides our nurses with a better onboarding experience. They typically have increased engagement and job satisfaction and really reduces turnover costs associated with turnover of new grads that don't have a structured program to transition into. As well as you'll see nurse residency programs that are accredited have higher quality and safety outcomes due to their standardization and how they transition nurses throughout their program. You'll see that there's enhanced clinical competence, improved patient outcomes, and essentially improved quality. And there's leadership confidence because now there's more of an objective assessment of your program. How effective is it? You're able to benchmark your program against national standards, ensuring that your program is top-notch. And so there's a lot of not only benefits for the organization, but also for the participants, right? So professional development and growth is huge. There's a huge increase in confidence and competence among the participants, as well as improved clinical judgment, clinical reasoning, because the program really is setting you up for success in those capacities. A nurse residency program that's PTAP accredited really supports your learning environment as a nurse going through this program. There's a lot of mentorship, peer support, so everyone's going through the same process together and really learning together as one. The program is evidence-based, so it's current, it's aligned to the highest level of evidence, best practices among the literature. And we really provide focus on incremental goals throughout the program to really ensure that your nurses are meeting that and they're set up for success. And a PTAP accredited program also provides career advancement and enhanced professional development opportunities for your nurse residents. So some things that you should know as you're thinking about your PTAP journey or just getting started. So the accreditation and the commission really looks at your program design. It's more about just documentation, but there's so many aspects that go into it. So looking at your program design, how is it designed? Does it meet the standards that is required to obtain accreditation or accreditation with distinction? What does your organizational support look like at your organization for new graduate nurses? What do you provide them at the organizational level and also at the unit level to ensure that you continue to set them up for success? What are some of the learning outcomes that these nurse residents are focused on, right? And then they also want to always understand about the nurse resident experience. You know, what you write is one thing, but also what they see when they speak to the nurse residents, the preceptors, and all the stakeholders really should enhance what you wrote in the documentation in your narrative. And then they also evaluate not just your outcomes, but how do you continue to move the dial with your program? How do you continue to improve the quality of the program and your program goals and outcomes? Accreditation is a journey, and that's one of the tips of success that NCP provides and PTAP provides really. So it requires strategic planning. It really demands stakeholder engagement. If your stakeholders are not engaged, you don't have buy-in, there could be some pitfalls that you experience. And it involves ongoing evaluation and improvement. So, you know, you need to continuously evaluate your program and see what's the latest evidence and how can you continue to move the dial to ensure that, again, you're well positioned to continue to sustain that high bar and continue to elevate your program. So PTAP is focused on 5 domains, right? The first one being your program leadership. This really defines your leadership structure, and it ensures that the program has an accountable owner, which should be the program director. It also ensures in this domain that you're focused on how do you operationalize your program consistently across the system. Then there's organizational enculturation. Think about that as your organizational hug. How are our nurse residents integrated and assimilated into the organizational culture? The third domain is development design. So it's really focused on how does your curriculum, how is it developed? How is it designed? How is it evidence-based, showcasing that? How do you have a competency-focused framework to ensure that your competencies are aligned to your curriculum, and how do the nurse residents really achieve that through the development design and the reformatting of your curriculum on an ongoing basis to meet those competencies. And then practice-based learning is the fourth domain, and it's really focused on learning opportunities in the practice setting that nurse residents are able to achieve. It's also has a component about mentorship and peer support and preceptor support, as well as the skill development. This could be skills like time management, prioritization, professionalism, different aspects that nurse residents learn and apply in the practice-based setting. As well as the fifth domain is the program goals and outcome measures. The outcome measures really showcase the impact of your program aligned to the program goals. And there's always really monitoring of continuous improvement. So if you are not meeting the goal that you have set out, what are some measures that you're implementing? What are some action items that you're doing to continue to move the dial? Some of the common accreditation challenges or pitfalls that we may see, sometimes are documentation gaps. That's, I think, one of the biggest ones we see, right? So either we're missing evidence, there's a lack of standardization of a process, right? So processes throughout the program need to be standardized across the system. And again, that's not one of responsibilities of the program director. And so sometimes you see that there you're not able to see those standardized processes across your program in the narrative that you wrote. Also, there may be lack of detail in narratives, right? So you always want to paint the picture for the appraisers to really understand your program from start to finish. So sometimes those details are not embedded either in the process or in the demonstration. So either in the description or the demonstration of your narratives. Also, there may be some issues with outcome measures, right? So there may be insufficient data collection or limited benchmarking, or the data is not shown appropriately in an aggregate form, or there may be lack of utilization of at least one valid and reliable tool that is outlined as a requirement in the PTAP standards. Another common accreditation challenge is lack of stakeholder alignment. And so maybe your leadership is not as engaged, right? Or there's unclear roles and responsibilities of who should own what, and maybe lack or limited interdisciplinary involvement within your program. And stakeholder alignment and buy-in is so key within this program, as well as within the accreditation standards, because you really want to speak to how your stakeholders are have buy-in and demonstrate that buy-in throughout. And stakeholders, remember, include anyone that is involved within your program, from your nurse resident to the executive leadership team. So some of the things that surveyors look for, so some things that you should keep in mind, is evidence of how the program is effective, and how you are doing this program standardized across the system. So for program effectiveness, your outcome measures are going to be key in really understanding and showcasing how your program is effective over time, as well as standardization. Something to consider is your quality assurance process, how well you are showcasing that your program is operationalized consistently throughout the system. Also, surveyors look for nurse resident success. How do you measure success? How, testimonials from all of your stakeholders when come time for site visit is key, as well as leadership continued commitment and engagement to the program in general. And again, continuous improvement is very important. So how do you continue to modify your program? How do you continue to make it evolve, so that you can continue to raise the bar and provide the best transition of practice for these novice nurses transitioning to the profession, or even experienced nurses transitioning to a different specialty. So accreditation readiness roadmap, some things you should consider, and what are some steps? So the first thing is conducting a gap assessment is really critical. So reviewing your current program, aligning it to PTAP standards, understanding what are some strengths, what are some opportunities, what do you have in place, and what do you still need as some potential action items, and prioritize those. What is the highest level of priority in order to continue to move the dial? I would also recommend developing an accreditation plan. So think about a timeline, make sure that it's realistic. Assign responsibilities. Maybe there's content experts that can help support you in some of those writings of those narratives, or maybe it's an educator, maybe it's your site clinical coordinator or your program manager, to really help move the dial. Also create realistic project milestones. When is your first, second draft due? Step 3, I would say really focus on strengthening your documentation. Think about your evidence. You do need at least two evidence, two sources of evidence aligned to the story. So really ensure that you have evidence that speaks to that narrative. Make sure that your processes are standardized when you're speaking to them, that you're including all sorts of who, what, when, where, how, why in your narratives, and really think about that as you're developing your accreditation narratives, making sure that they're as detailed as possible so that the surveyor can really put themselves in the same place and understand what you're speaking to. Also, you want to validate your outcomes. looking at your program goals and your outcomes is really, really critical, and ensuring that you have outcome measures and goals that are SMART goals. Um, Also review your nurse resident feedback. That is key. They're going to ask you for surveys and then survey your nurse residents that go through your program. So you want to understand nurse resident feedback. You want to try to be able to integrate nurse resident feedback in your program enhancements. And then you also want to demonstrate continuous improvement. If you're not meeting that benchmark, what are some things that you can do to, and how can you engage the stakeholders to continue to improve that goal and outcome measure? And then you always want to prepare for the review, for the site visit. So conducting mock interviews, a mock site visit, reviewing your evidence again and sharing that with your stakeholders. You want to ensure that stakeholders are ready for your PTAP journey, that you're involving them in every step of the way, but that you're also involving them in preparation for your site visit. So how can nursing consulting partners support your success? So we really provide comprehensive accreditation support, and one of the things we do is a readiness assessment. So this is a full review of your current program. We do a gap analysis against the PTAP standards and really identify where you lie, what is missing, what are some potential risks or vulnerabilities, and customize recommendations based on best practices, what we've seen out there. We have a lot of expertise in different areas of nursing leadership, specifically magnet, PTAP, professional governance, leadership development. So we are well versed on how we can support you on this journey. Also, strategic planning. We look at how can we help you with a timeline? What are some resources that you're missing? And really, how do you engage your stakeholders appropriately? Another key thing that we do to really help support you is the documentation development. So evidence mapping is really key. Aligning on a project plan, your documentation, your narratives, how do they align to the standards, but also helping revise or even write the narratives are something that we can help support you along the way, as well as outcome measure support. So we can develop your program goals and your outcome measures, identify those KPIs and potential benchmarks. Another thing that we offer, another service, is really our mock accreditation review, and that could be a virtual site visit preparation. We're available to come on site if needed, but most of this can be done on a virtual basis where we really help support your leadership team, your nurse residents, all key stakeholders on what to expect for the site visit and how can you prepare appropriately. And then another very innovative technology solution that we provide, which it really helps you in almost like a centralized hub for your writing, also for housing your program goals, your outcomes, so that you're able to easily see where you lie with your outcome measures. For those programs that have, those organizations that have large programs across the system, this technology platform that we offer is huge, and it's instrumental because it really allows you as a program director to have a global view on where you stand with your bi-weekly meetings, where your program goals, with your quality assurance process in just one hub. So it is a really great resource for our nurse residency programs and fellowship programs that are going through PTAP accreditation. Why should you partner with nursing consulting partners? So we are owned and operated by nurses, and so we really understand the pain points. We understand what it's like to go through this journey, and we have a lot of consultants that have a lot of experience in this capacity, along with others, like I mentioned, of magnet, professional governance, leadership development, to name a few. And so we really help organizations reduce accreditation preparation time, avoid those common pitfalls before they actually happen, and really build sustainable processes. We set you up for success and improve that accreditation confidence and really strengthen long-term program effectiveness so that can ensure that we support you along the way, but not just in the interim for your journey, but something to set you up for success long after your accreditation preparation is done. And our approach is very collaborative, it's individualized. What's going to work for a small organization not doesn't necessarily work for a larger organization at times. So we really make sure that the support that we provide is individualized, and we find you the right consultant that can provide you that great fit and customized fit. We are evidence-based. We have had experience again in PTAP significantly, and we know what best practices are out there, and really everything that we provide to you is evidence-based, and we also focus on sustainable outcomes. So if you are interested in more information about the services we provide at Nursing Consulting Partners, I urge you to please give us a call at 855-373-8729, or you can fill out our contact form at https://nursingconsultingpartners.com. Thank you and have a wonderful day.